The number of wounded has not stopped. As you probably heard in the background, the bombing is still going on around the area of the hospital. More and more children are being brought in. I've actually just been operating on children since I last spoke to you. Kids who have been taken out of the rubble of their own homes. This morning, a little girl with really severe facial injuries, whose mother is a doctor working at Shifa, was killed. The mother was killed. This little girl is going to need repeated reconstructive surgery for really until she reaches adult age. Last night, the last patient we finished in the early hours of the morning was an 11-year-old boy who was taken out from the rubble of his home. We didn't know who his family, where his family was. We didn't know his name. We gave him the tag name of unknown child number 6. And that's been the reality of this kind of continuous stream of patients and of the building shaking every few minutes as the area around it is being targeted.
You've worked there for a while. You're used to working under conflict situations, but how are you finding this? And I mean, the noise from the explosions is incredibly loud. And as you say, it makes the building shake.
The ferocity of this attack, you always have to keep reminding yourself it's only been 4 days. But the sheer number, 4,500 wounded, 900 killed, that's just the ferocity and the destruction, that kind of leveling of whole neighborhoods. Has just been horrendous. I've been here in the 2009, 2014 and 2021 wars, and there were nothing like this. Even the 2014 war was not as bad as this, and that was quite an intense war.
And in terms of the people that you're treating, you were talking about that first child, the child who's the child of one of your colleagues. How is that? How do you cope with dealing with the fact that you know your colleague is dead and you are now treating their child?
I think for all of the staff and the health workers in the operating room, when they had heard that this is the child of the doctor who had worked with them, there's a sense of foreboding that this could be them and their families anytime. And it's always difficult when you're operating on a child. And even though I've been doing this kind of work, not just in Palestine, but in Syria and in Mosul and in Yemen, there are moments that kind of take your breath away. You kind of feel winded when you see a beautiful young girl, the braids, the elastic hairband, the pink elastic hairband, as you're trying to clean the face and in your mind, go through your mind, just what are the steps you're going to need to do to try to put this back together again. And then you see this and you're reminded that this was someone's baby child.
It's so difficult. It's unbearable to think about, isn't it? How long do you think you can stay there and continue the work? Do you fear that you're going to have to leave the hospital?
I think in terms of safety, I'm going to need to stay in the hospital. How long? I'm going to stay here and as long as it takes, until there's a ceasefire or until there's a humanitarian corridor. But once you're in, you're in. And the Israelis have just bombed Rafah crossing, so there's no way out. We're here for the duration. And we will do whatever it takes to try to provide whatever help people need.
The electricity, we are hearing different reports about the electricity supply in Gaza. I don't know if you're able to tell us whether you know whether or not it is now been switched off. Reuters were reporting an hour or so ago that it had been cut off. Are you aware of that?
Yes, the generators have been on all day, so we're now on to diesel supply, and we know that that's going to eventually run out because the Israelis announced total siege and no diesel is going to come in for the generators that keep the hospital. I think at any minute they're going to start rationing the electricity supply and just trying to save as much for the operating rooms and the intensive care areas. we're already beyond the capacity of the system to cope. Already I have 50 patients waiting to go to the operating room that I cannot get to the operating rooms because the priority is for more critically ill patients. And as these surgeries are delayed, these injuries run the risk of becoming infected, and these wounds become more difficult to reconstruct, and the disability that is left behind much worse.
What happens when the diesel runs out? How long do you think you can keep the hospital running for?
Once the diesel runs out, you can't run the anesthetic machines in the operating rooms, and you can't run the lights, and you just have to stop.
How long do you think you've got?
My feeling is that the Palestinian health system has the rest of the week before it collapses, not just because of the diesel. All supplies are running short. The number of wounded has completely used up what was already a denuded system and a crippled system as a result of 15 years of siege.
Well, Professor Ghassan Abu-Sittah, it's really good to talk to you. We appreciate you joining us, and we may try, if you're able to check in with you again at the same time tomorrow and find out how it's going. Thank you so much for joining us from Gaza.
Thank you.